There was a period of time I literally could not drive more than 40 minutes without severe leg pain. The biopsy results were in. Doctor looks at me and he says, 8 of the 13 cells are cancerous.
With prostate cancer, we are beginning to integrate genomic testing. We compare that to hundreds and thousands of patients to allow us to say, what is the likelihood that this is an aggressive cancer?
The two of us said to each other, whatever it is, we can deal with.
My personal goal is to squeeze every drop of life out of this great opportunity. Look at the fish. Hope we see Mr. Snappy. All right. I'm 70 years old. I have 5 beautiful grandchildren, 3 grown children, and I've been married to my sweetheart, Carol, for 29 years. I have several hobbies. Number one, it's traveling. And then our life here in the neighborhood revolves around tennis.
Rick is about the healthiest person you could ever hope to meet. He works out, he eats better than he ever has.
There was a period of time that I literally could not drive more than 40 minutes in a car without severe leg pain in the back of my legs, like kind of in the hamstrings.
He assured me that this had to do with his exercise routine and that sort of thing, so I really didn't worry about it. Rick had different kinds of tests. Before we went in to find the results, the two of us said to each other, whatever it is, we can deal with.
On our way home, I still just was shaking my head in disbelief. My name is Rick, and I have prostate cancer.
The prostate gland is really an organ in male patients, and prostate cancer is basically cells within the prostate gland that are not quite functioning according to design. And so when these cells begin to become more disorganized, that's how prostate cancer really develops within the gland. The causes of prostate cancer is currently unknown. Are there risk factors? Yes. About Agent Orange, smoking, red meat, family history of prostate cancer. Really just by being a man, by just growing older. Risk factors based on ethnicity is actually quite fascinating. Men from Asian population do not get prostate cancer in the same frequency as men of African origin. Men of African origin is about 1:4. The warning signs and symptoms of prostate cancer is varied, but in the majority of cases, there are no warning signs. And that's what makes people call this a silent killer. The only real sign is an elevated PSA, prostate-specific antigen, in the bloodstream. And the reason for that is that prostate cancer cells produce PSA at a much higher level than the normal cells.
I would say to any gentleman over the age of 40, get your PSA test. Early detection is the key.
Sometimes a man will come into the clinics with advanced disease, not from the PSA test, but really from symptoms.
I have this wonderful GP doctor, and for a period of about 6 to 12 months, he was concerned about my elevated PSA. So when it reached a score of 7.2, he said, enough. He said, I'm referring you to a urologist.
Prostate cancer diagnosis is a multifactorial approach. You want to know your PSA. You also want a systematic biopsy to derive what we call a Gleason score or a Gleason grade that allows us to know the extent of aggressiveness or advanced nature of those cells. And also you want to complement that with an exam to see how advanced it is. And that forms the three-pronged approach to really be able to diagnose prostate cancer. The PSA, the DRA, and as well as the Gleason score.
We started with a physical inspection, and then the doctor ordered the MRI, and then 2 weeks later called me and said, we're going to schedule biopsies in the hospital. We saw on the pictures we saw concerning spots. About 2 weeks after the biopsy results were in, I had my meeting with the urologist. The doctor looks at me and he says, "Yep, 8 of the 13 cells are cancerous."
I'm like, well, what does that mean exactly? And we really didn't get a lot of information.
When you hear that news, first thing you're in shock. But then it hit me, and it hit me because that's when I knew I would have to make a phone call and do a FaceTime with the kids.
We had a family meeting by Zoom.
Hey guys, it's Dad and Carol. Thanks for jumping on the call so fast. Just came back from the urologist appointment, and unfortunately got bad news.
I think we're going to be able to take care of this, but we need to just figure out how.
Yeah, and so
Having had breast cancer myself 15 years ago, that we were treated at Moffitt very successfully, we decided Moffitt really probably was our best choice.
So once you've diagnosed prostate cancer, you want to stage it. The staging is very important because that then allows you to administer the appropriate treatment. In modern medicine, with prostate cancer precision oncology, we are beginning to integrate genomic testing as ways to personalize the care for our patients. I use the Decipher testing to allow us to say, what is the likelihood that this is an aggressive cancer? So when we layer on genomic testing and look at the mutations and the expression profile, and we compare that to hundreds and thousands of patients that have gotten prostate cancer over multiple decades, you have a better sense of what you're dealing with. Slow growing simply means that you develop the prostate cancer and it's going nowhere. Then you have the aggressive kind where within a few months to years, it just quickly takes off. If it's localized, you're looking at surgical options or a combination of either external radiotherapy or in some cases internal radiotherapy known as brachytherapy. If you end up being metastatic, oftentimes the bedrock of that treatment will rely heavily on blocking testosterone because prostate cancer cells feed off the body's testosterone, and then you lay on other therapies based on the response.
Hey, doctor.
Hi, how are you
How are you?
doing? Good to see
Good to
you.
see you.
Wow,
Dr. Yamoah was wonderful. He helped us understand what the process was going to be. But at the end of our first consultation, maybe the second consultation, he said, and of course, along with radiation therapy, we will be doing hormone therapy. And I have had enough of my own experiences with hormones and what they do for a person that scared me a lot.
It has an effect on decreasing your energy levels. It changes your metabolism, makes you feel like you don't want to do much.
Talking to each other about our lifestyle and what was important to us, we just decided that it would be better not to do that.
Dr. Yamoah immediately accepted my decision and said, you know what? We'll just add 2 more passes of radiation to each side on the lymph node side to cover any possibility that any of these cancer cells venture outside of the prostate.
And in that case, we were able to safely, in the safest possible way, avoid hormones.
My radiation treatment began in the middle of May. It was 26 treatments in 5 weeks.
Throughout the whole time of treatment, Rick kept such a positive attitude. It made it very easy for me.
My faith in God gives me the strength to handle a situation, and I chose to stay positive through it. So when we were concluding my radiation treatment at Moffitt, we asked if we could provide lunch for the whole department.
We've gotten it down to quite an assembly line.
We baked about 8 pounds of pasta and meatballs, over 100, salad, bread, and we brought it up to the team to thank them.
The emotional toll that cancer in general has on family members is significant. And there are a lot of support groups that do that very well. In fact, at the Moffitt Cancer Center, we do have a lot of advocacy and focus on that.
I mentioned to Dr. Yamoah and to KT, the PA, is there something I could do to give back? And they said, well, you would be wonderful for this patient advisory and family program where you would get the opportunity to meet men and women going through radiation, chemo, infusion, and talk to them about your experiences.
Good morning. How are you
I've been
today?
doing it now for over a year. I think that's my
I'm,
purpose in
with
life right now.
Patient Advisory
It's just such a positive experience for him.
I'm here to kind of answer any questions.
So for prostate cancer, once it's all said and done, how do you follow up to make sure that the treatment worked or it's not coming back? And unlike a lot of other cancers, we rely heavily on the PSA. If the cancer is there, the PSA will be elevated. If you had surgery, there should be no PSA in your body at all, because the prostate gland is the only source of PSA production, and hence it should be undetectable. We start checking it more frequently immediately after treatment. If that changes, then that's an indication that we need to go back to the drawing board and figure out where is this PSA coming from.
Looking down the road, we know Rick is going to continue to have tests of his blood work to see that his PSA isn't going up. So far, all it's done is go down. So that makes us very positive.
My initial PSA scores that started in the 7.2 range, it's 0.09.
Prostate cancer is a disease entity that is highly treatable when diagnosed early. There are a lot of advancements in prostate cancer, such as flash radiotherapy and proton therapy and advanced brachytherapy, all the way to where we can actually have improved robotics to have nerve sparing for surgical specialties, to be able to actually now use novel agents where you can have isotopes that are specifically going to light up only where you have prostate cancer. So I really truly believe that the future is really bright for prostate cancer, and we will end prostate cancer in a lifetime, or we will actually make it a chronic problem and no longer a death sentence.
Prostate cancer definitely changed my lifestyle. We eat healthier, we exercise more, we appreciate life more, and we appreciate each other, Carol and I, more, and we appreciate our kids and grandkids more. My personal, goal in my senior years is to squeeze every drop of life that I can out of this great opportunity. And one of the ways is through giving back at volunteering and being there for my family.